All right. Well, I think Dennis's comments about civility and the ability of this board to have entertained at times controversial topics is well taken. And we have many districts around us and pretty close by, sports rivals, conference rivals, in many areas that have not had as collegial and harmonious relationship as we have enjoyed in our district. And I appreciate folks who came tonight to share their thoughts on the district's mask policy and how they feel about it. And we certainly appreciate hearing from you on that. I do think it's important for us to lay out some clarifying information about just sort of the context of, because we have had some confusion about the recent Supreme Court decision, and I think also to put it in the context of what this year has been like as a school district. And I think if you've been coming to these meetings or watching these meetings online, Dennis made a good point. We've had a lot of folks who have participated online over the past many months. I would note that this board has met at least partially in person throughout the entire pandemic on the advice of district council. So I would like to thank our members who on a rotating basis have been willing to make that sacrifice and be here to do that. And I think a lot of times we have spent over the past few months looking at our success stories and talking about the fact that our district, unlike many of those around us, we've had kids on premise since last July in summer school. That wasn't an easy thing to do. This is a district that went virtually overnight from having one school building in the district with one-to-one instruction to having virtually all of our school buildings with some form of online instruction capacity last spring, which took a tremendous effort on the part of all of our staff and parents and students. But folks adapted. It wasn't always easy. It wasn't always pleasant. There were lots and lots of glitches and lots of technical problems, and you get a real short course very quickly on the shortcomings of broadband in our area very quickly when you start to require people to be receiving their instruction online. But we have not had to, unlike many districts in our state, we've had students, while not here in the buildings full time, we've had students in these buildings since last summer. And we've done so not completely without problems. There have been incidences that we've had some short times where we've had to quarantine specific classrooms, or we've had to quarantine a grade level or things like that, but we have not had to go through the large-scale district-wide or school-wide disruptions that many of our counterparts in other parts of this county and other parts of this conference have had, where they've been in full person and then out and then in and then out and then back and forth with a lot of disruption for their students. And that has not been easy. It has taken a good deal of discipline, a good deal of tolerance, and a lot of patience on the part of everyone, from the youngest students to the, I won't point to, I was just going to point to Jeff, say the oldest administrators. Jeff is not our oldest administrator, I'm sure, but although he might be by the end of the year. But it has taken an awful lot of patience and tolerance from everybody, and we certainly appreciate that. But the other thing that it is taken is an abundance of caution and care to make sure that our students are as safe as they can be, our staff are as safe as they can be, but also that our community, that we are not an island in this community, that we are part of the public health picture in this community, and that our students go home to places where their parents are, to where they might have grandparents or aunts and uncles and relatives, and we don't all live in a bubble. And to that end, I think our folks have done a great job collaborating with county public health, with our local healthcare providers, with folks in other districts for best practices. I think we had quite a collaboration in getting our vaccinations done for our staff as part of an effort across multiple districts, working with local pharmacies and just really a Herculean effort. But at every turn, it has taken an ability for people to be willing to do what is right, maybe not what they enjoy or think or is pleasant. I can't stand wearing one of these things. As you can see, my mask keeps fogging up. And I have dropped my glasses I don't know how many times in the grocery store because I tend to do this with them when I put my mask on. But nothing that we've been able to or had to do this year has made everybody happy at all times. But what we have had is a lot of success. It was until just recently, I believe in March, we had our first verified case of school-based spread after having students here since last July. That's remarkable. We expected that could be something that was a weekly occurrence when we decided to have kids back. And instead, we were most of the way through the school year before that happened. We've not, as I mentioned, had to have quarantines where people have come back. And recently, we have embarked on an ambitious plan to bring all of our kids back in for full in-person instruction. And that has not been easy, and that is taking an awful lot of work, and it's forcing us to rethink some of our regulations that we've had in place before. The social distance that we had at the beginning of the year is not going to be the same as it was before. And that's not going to, a lot of people are going to be outside their comfort zone when that happens. But we've relied on the best guidance that we can get from things like the Centers for Disease Control, our local healthcare providers, using facts and science and data to help guide our decisions, to do things and make changes that we think, while not risk-free, are worth the risk in order to bring kids back. While I realize folks are frustrated with masks, everything that we hear from the folks that we have been partners with and that have helped us to have these successes until this point says your masks need to, you need to have a required mask policy to even contemplate bringing kids back. That there's not a way to contemplate this without that. And I guess that could take us to the Supreme Court decision. I think there are folks who think that our state Supreme Court, that decision somehow made the state mask mandate unconstitutional. It did not do that. It actually simply said that the governor did not have the authority, because he had a 60-day authority, not an indefinite authority, to have a mask mandate in place. The court was explicit and very clear in saying that local units of government have the authority to put mask mandates in place. In fact, as a point of fact, this school district's mask policy predated the state mask mandate. We had a mandate or a policy in place before the governor declared that emergency statewide mask mandate. It remains in effect. The Supreme Court decision had no effect on that. It will remain in effect going forward, and that may make folks uncomfortable. And while I look forward to the day when we can all take these masks off, I also look forward to the day when we're going to have all our kids back in these schools, and that day is coming in just a couple of weeks, and we're going to have them all back. And that, I think, is a tremendous, tremendous accomplishment for all of the folks who work in this district, the parents who are taking risks and who were surveyed and shared their opinions and thoughts with us, and their concerns and their fears about it. And I think that when we get to that point, while we can all certainly take a little bit of a victory lap and slap each other on the back at how good of a job we have done, it won't be over, because this thing is not going away just because we want it to go away. Caseloads are actually increasing again. There are different strains. So a study out of Israel just this week saying that certain vaccines may not be actually effective with new strains that are coming out of South Africa. There's a lot of questions that are still out there, and the best way for us to keep people safe is to keep our protocols in place. So we are probably not going to be moving off these protocols this year. I hope, knock on whatever the heck this table's made out of, I doubt it's wood. Hopefully next year we won't have these things on, and we'll be able to smile at one another or scowl at one another or do whatever we need to do. But in order for us to make a success out of this year and to bring those kids back, which is our top strategic priority here, we're going to have to keep this mask policy in place. So it is not likely to change, and while that may be a frustrating thing to hear, I believe that honesty is the best policy, and we shouldn't create false hope here. And there is no way for us to contemplate having all these kids back without our mask policy in place. Not if we're going to rely on facts and science and data and the recommendations that we're getting from our healthcare partners and Centers for Disease Control. So we will continue to be guided by those principles, and we will continue to be happy to hear from folks, but that's where we're at.